Welcome to the High Efficiency Practice, a podcast focused on how leaders build more efficient healthcare and wellness businesses. Hosted by Brenda Mana, the show explores what works across operations, growth, and performance. Today's guest is Dr. Desmond Bell, a former surgeon, wound care specialist, and healthcare innovator with more than 25 years of clinical experience. Throughout his career, he has led advancements in wound care, founded the Save a Limb, Save a Life Foundation, and helped bring new medical technologies to market. Today, as president of WoundScribe AI, he is working at the intersection of healthcare and artificial intelligence to improve clinical decision-making, streamline documentation, and enhance patient outcomes. In this conversation, he shares his perspective on the future of medicine, the evolving role of AI in healthcare, and what it takes to transform patient care at scale.
Welcome, Desmond. Today we'll be diving into medical practice, technology, time savings, and cost efficiency. We'll start with your background and trends.
Thank you. It's a pleasure to be here. I'm looking forward to our discussion today. I think it'll have some relevance to people tuning in, where they are in their careers. It's been a unique journey. My name is Dr. Desmond Bell. I'm no longer practicing clinically, but I did for over 25 years. I was a podiatrist. I was a surgeon and specialized in wound care and lower limb preservation. My career took me into having a wound center. I had the first mobile wound care practice in the U.S. back in the early 2000s. I've been involved in research, published. I started a nonprofit organization called the Save a Leg, Save a Life Foundation, trying to do better for my patients. I was introduced to a gentleman from a chemical engineering background, and we collaborating on ways to heal wounds faster. That turned into a product and a company called Omeza, and that got me into moving away from the clinical side of practice because I felt if Omeza were successful, I could help more people than I could one at a time. Ultimately, things didn't work out there, and I found myself learning about the AI world and now serve as the president of a startup company called WoundScribe AI. The journey's hardly over, and it's opened up all these other possibilities now, and I'm excited by what's ahead.
Can you tell me a little your role and how it fits WoundScribe AI today?
WoundScribe AI was introduced to me last year. I was presenting at a wound care conference, talking about what to expect if you're a clinician and you have an idea for a product or you want to patent something and all the steps that it takes to get that product to market. After I finished, I was walking to go get some coffee, and this gentleman came up to me and he said, "I want to show you something." It turned out to be Shayan Mehrshadian, who's the CEO and founder of WoundScribe AI. Shayan's background is fascinating. He's been in the Silicon Valley world for over 20 years. He pulled out his phone and started showing me a picture of a wound, and he tapped the button, and all of a sudden the wound's being measured. Then it was giving a complete description of the wound in about 10 seconds. Then he proceeded to show me other aspects of it, including full documentation, help with differential diagnosis, even billing and procedure. And it's like, whoa. I was intrigued because the first impression that I had was, wow, this can be an incredible tool, because there are some issues in the wound care world. People don't realize this, but if you're a specialist in wound care, there's no formal training. There's been one fellowship in wound care in the country. That was Dr. Ennis in Chicago. But how do you learn wound care? Most of it is on the job training. People come from diverse backgrounds, whether they're a nurse, a podiatrist, ER physician, physical therapist. Where do you get better? There are courses and conferences you can attend, but still there's this real gap in knowledge. A lot of it is trial and error. But I saw what the AI platform could do. It's like, this can close the gap on this disparity in education and experience. I've seen 30 to 50,000 patients, surgeries every day in clinic. The stories and the experience I have made me better over time. And I looked at this, wow, AI, if you start putting data in from other clinicians and it starts to get better and better, the ability to allow a clinician to take a picture of a wound, to get all this information, and then to help with proper diagnosis, proper treatment plan, it can save precious time. That will lead to better outcomes for patients. It's going to give clinicians their life back too, because I would spend sometimes almost half my day documenting, entering information into an EHR. If this can fill that gap and take the place of an EHR or be an EHR, as well as this tool that's there for 24/7, wow, now I could see potentially more patients, or I could go home earlier, spend more time with my family. On top of it, there's this whole patient education platform built into it too. As a clinician, I would be frustrated to the point where I would ask other clinicians, do you feel like you're having the same conversation with your patient over and over again? You realize that there's much going on in a clinic setting for patients to retain what you've spoken to them or tried to teach them or convey to them in that encounter, it's often gone by the time they exit the clinic. Even if you give them a pamphlet or written information, they still don't know what to do with it a lot of times. We've built into WoundScribe AI patient education component that is interactive. It's almost like a Duolingo for the patient. We've tracked it and found that they will sometimes spend half hour, an hour on this, learning about their condition and their encounter that day. This is comprehensive. The big difference is this was not only created by techno geeks, but pooled concepts and ideas with clinicians. We have podiatrists, nurses, MDs who will put our heads together to create this platform that we know will be effective, but will also optimize the workflow in a clinic too. It's ambitious, but I see where this is going. And I think 5 years from now, we'll look back and say, man, the way we were treating wounds was archaic.
As a patient, it saves time from doctors, cost savings, time savings, but it also stabilizes the outcomes, success. Having 2 kids who fell in the park, we have to visit emergency rooms with cuts on the head. The number of pages that you need to read to figure out what you need to do with the wound is like, yeah, I got all the information out of 5 minutes of podcast talk from the doctor, but by the time I left, I retained probably half. I was paying attention. I think what you're stating is revolutionary. What's a day in your life for WoundScribe?
Where you're receiving your treatment has a real impact on your outcome. People in more rural settings may not have the same access to care as somebody in a city. But even patients in a city setting often have problems with mobility and making appointments, especially people with diabetes. When people have chronic wounds, they have a lot of challenges. To have that 24/7 access to information that's relevant, including their own case, it helps. In my clinical experience, the more information you share with your patients, show them photos of their progress, there was greater buy-in to your treatment plan and less pushback. We're going to get you healed up, but here's why we're doing it, and here's the proof that it's working. Now, you combine that with the educational platform, and it's powerful. To answer your question, I wanted to stop because you made such an important point. My day is fast and furious. My day can start out with a couple things on my calendar, and before the day's over, I've spent 8 hours or longer on calls, meetings, introducing our platform, internal discussions, working on some projects. Every day is different, and it's fun. It's a challenge. It's tiring at times. You don't know what you're going to get. But we're in this phase right now where we're still raising capital, and we're ready to start being a real company now with real employees and real structure, real payroll, real benefits, all that type of stuff to get us going. The feedback that we've gotten from potential customers and clients is people are ready to go. They know that they need to know about AI. They know that there's something here, but they also don't want to be left behind. It's this really unique time. It's certainly a unique platform. The fact that it was developed specifically for wound care, then it will be able to cross over into other areas of medicine. But for now, this is not an AI platform that you just slap into your EHR and that's it. No, this was built from the ground up. And it was built from the patient education part of it too. It started with this idea. It's called Pingo, Pingoo. You'll see the logo. It's a little penguin. And that was where the concept came from. But then it was like, wow, we're trying to help with diabetes and educating patients. Then it was like, why don't we just bring this to the clinicians as well? And there it snowballed. One idea has led to another.
What's the EHR in the medical healthcare sector like? What are the trends?
I think what we have right now is our starting point. I think it will evolve into other areas, and we're already working on them. But to be clear, we're not an EHR. Presenting this to colleagues, people are saying, oh, you guys are an EHR or you're a scribe. And it's like, yeah, we are, but we're also this and we're also that. If you look at our platform, you've got ambient listening. It's going to record the conversation between the patient and the physician. And from there, it's going to begin producing a note, the encounter note. You're able to take photos. It's going to do measurements. It's going to help with the diagnosis. We're going to follow the trend of how the wound is doing and look at the healing trend. If things are not improving, what can we do to change that? Going back to my career, I've been around long enough to have been here before we had EHRs. When people had to handwrite their notes, it was arduous and you couldn't always read another doctor's handwriting. Then came EHRs and there was pushback. A lot of docs retired rather than do that. I've had to be part of multiple EHR systems. So the first ones were not even web-based. You learn how to adapt, but there was still resentment because you're just hours a day entering data, putting information into this platform that you're not getting anything back out of it. It's not helping you with your decision making. You're just documenting measurements or medications or that history in a hospital setting. It's horrible when you look at notes that have been copied and pasted encounter after encounter. And it's okay, this is the exact same note that I was reading 2 days ago or a week ago. We've got this ability to provide a unique note every time, audit worthy for sure, but to streamline that workflow, that you're not just putting in this information into an EMR. Now you're getting this learning capability where the system is going to get better and better over time. It's going to get smarter. It's going to help you with your decision. It's not providing decision making for you. It's assisting the clinician. It's here's some options for you. You may have overlooked this. And EHR doesn't do that. It's IT and it's AI, but it's also a holistic approach. That's what we've always been shooting for. How do we raise the bar? How do we address this? I think that's where we're at.
It's a two-way street in which the physician's knowledge is enhanced by what it's getting from WoundScribe and also the visual baseline of the picture at the moment of care. If that same person comes back 2 weeks after, you can say, oh, it has progressed or it's exactly the same, which is bad because time passed and something should have happened and course correct. Now that we've covered the ecosystem in care, what are the challenges that you're facing?
We're ready to get out of the gate and people are approaching us. I want to be certain that we're going to deliver what we promise. I know it's going to get better with more use. Right now, it's in its infancy. There may be some unanticipated hiccups, although we're doing our best with the years of clinical and IT knowledge to make sure that we've thought about every possible scenario. Over the next 6 months to 12 months, I see this is going to take off. We are being approached regularly by clinicians, by institutions, clinical research organizations. So I think we'll start baby steps. We're already working with academic institutions where they do clinical research, and that'll be our starting point. From there, the wound care world, people rely on the opinions of the key opinion leaders and people who are in that academic setting or have done research. Before they try a product, they wait and see. Our approach is, because of my colleague network, I can reach out to some of the KOLs, present this to them, and so far the feedback has been overwhelmingly positive. Let's get people using this. And that's where I think we're going to see that old hockey stick type of graph. It's going to start going and then I think it's going to explode. I feel confident about that. I don't know why, because I'm pretty conservative. I try not to get too excited or too down if things aren't going well. As a wound care provider, you got to be the eternal optimist. When you have setbacks, you don't get too down on it. You try and figure out how we can fix this or how do we solve this problem. I see this tool that we've created as another problem-solving tool in the toolbox. And it will be embraced once people see how easy it is to use, how much of their life they will start to get back at the end of the day, how much better their outcomes will be. That's the exciting part. It's going to be a pretty wild year.
It sounds like you're going to have a lot of work ahead of you. If you would have given a magic wand, what would you fix that it's not working right now in the context of WoundScribe?
If I had a magic wand, I would fast forward, get past all this laying of the foundation work and all the coding and tweaking and all the infrastructure that we're building right now and get us to the point where this is well adopted, that now we can start solving other problems with it too, other potential components to this. We do have some that I'd be happy to share with you. Having been in the wound care community for over 25 years, as a physician, you're frustrated because some wounds heal and some don't. You can try the same treatment plan on 3 patients. 2 patients, it'll work. Third doesn't. And you're like, what was the difference here? You can have multiple wounds on the same patient. Some of the wounds will heal, some will not. What is the difference there? If you look at why people have chronic wounds in the first place, there's something underlying that's wrong. You have to be a good medical detective and figure out what components are missing. The exciting thing about what we're working on too is biomarkers. The research at the University of Victoria in British Columbia, where Shayan's been working with his team, we're looking at about 180 factors involved in wound healing, not just pH or presence of biofilm or blood glucose level, but 180 biomarkers. Start out by developing a smart dressing to capture data from those biomarkers and realize what components of that wound are off or missing or not functioning properly. Then you can reverse the trend and move on to healing. We'll be able to customize wound healing for each wound, not just for each patient. This will interact with WoundScribe. The tentacles are starting to reach out beyond just AI. This is going to customize and interpret what's happening in that wound, but then we can come up with a more efficient treatment plan instead of throwing spaghetti against the wall and hoping something sticks.
Yes,
You know,
exactly.
the practice of medicine, there's a lot of practice that's gone on over the years. We've tried to, this is why we do research and best practices, follow guidelines, but to hone in what's going on with that patient, that wound, and address those needs. That's what I'm saying. We'll look back 5 years from now and say, man, how we were treating wounds back in 2026 was archaic. It's cause for some excitement internally.
Thank you, Dr. Bell, Desmond. We truly appreciate you being here.
Thank you, Brenda. I had a lot of fun.